Yeah, you may want to move so you can see it a little bit better, because this Confederate is going to get in your way. He's getting in my way all the time. But I'm going to make sure that he doesn't run away while he's doing the presentation.
Maria, she lives in Frederickson? I'll make sure she gets notified. What regiment are you with?
Yeah, I did. Thank you.
Okay, I want to welcome everybody here. This is the Society of Civil War Surgeons, and today we're going to do a simulated amputation of the lower leg. This soldier was wounded on the field. He was triaged, as we call, as you know today, triage, at an aid station, which was 100 to 200 yards behind the battle line. I would have sent out an assistant surgeon and a steward out to this aid station. It would just be preliminary. There was no surgery done out there. They'd give him some Lodrum, which was a pain medication during the Civil War, the main one, 50% alcohol, 50% opium. They would look at this. If it was a bullet wound, they would bandage it up and tell him to get back here. If it was just a flesh wound, they could actually bandage him there and send him back to his lines. Anything with a head wound or gut wound was considered fatal. They would give him some pain medication and put him off to the side to let him die out there. They usually never brought a head wound or a gut wound back here to the field hospital. We're 1 to 2 miles behind the battle line. Now he's been given some pain medication out there. He's still a little groggy, a little awake there. So the doctor's gonna take his probe, which is his finger, and he's gonna insert it into the wound. Okay.
It's all right. It'll be fine, son.
Put him out. Put him out.
Know that my Redeemer said he shall.
He is trying to find out where the bullet is or where the bone has been shattered. If the bone has been shattered, we don't know that yet. They would only amputate if the bone was shattered. You have no blood flow, no pulse. It's a dead limb. Get rid of it.
I can't find it with my finger.
Okay, can't find it with the finger. He's going to take a needleton probe, which has a porcelain tip on it. Now, all bullets were soft lead. So when he inserts this in the wound, wiggle it around, pulls it out, if it hit the bullet, it's going to leave a gray mark on the top of the porcelain tip. Did you find the bullet?
Yeah.
Okay.
He found it.
He's going to take bullet forceps now to go in to pull the bullet out. Sometimes bullet forceps didn't work. They'd use a gimlet with a screw mechanism, which would screw actually into the bullet. Okay. Now this is what the bullet looks like before it was fired. Mini ball. And this is what the bullet looks like when it's hit bone. It is just mashed up, flattened out. Now if it was a flesh wound, it would just pass right through, probably stay intact like this. But this is mashed up, so it's probably hit some bone. So the doctor now is going to take his probe again and go back in to see if the bone is shattered.
Bone is shattered. Bone is shattered. You agree?
Since the bone is shattered,
I agree. Bone is shattered.
the leg's got to come off, always 2 to 3 inches above the bullet wound.
I feel no pulse in either area.
No pulse, no blood flow, it's got to come off. He would take a Catlin knife, which is a double-edged knife, so he does not have to turn his hand. He is going to cut down through the muscle, the tissue, the skin, clear down to the bone, so he doesn't have to turn the knife. It can just go around in one sweeping motion down through there. His assistants will be retracting the skin, the muscle away from the bone, so we have a good place to amputate. Now that's what the tourniquet is on here for, to stop most of the bleeding. He might have a little bit of bleeding left, but most of it will be stopped with the tourniquet. He's got the bone saw now. He's going to go down through the leg, which is, you have 2 bones, the tibia and the fibula. And he's going to cut those off.
Do the first.
Usually this operation takes 7 to 10 minutes per patient. And that's what we have after a battle. If this gentleman had shot himself in camp, we could operate on him for 2 hours. Okay, the leg is off. Now, when you saw through bone, bone splinters like wood. So he's got to take a pair of Rogers bone nippers and actually nip the end of the bone smooth to get all the little slivers off. Then he has to take a bone file and file the end of the bone smooth. You want a good smooth surface. Now we did a guillotine amputation, which is the quickest, but it's not the best, because a guillotine is straight down. You don't have much skin to pull over. And skin shrinks, so in about 2 or 3 months, the skin will be shrinking. That bone will be protruding through the skin, and you're going to have to cut it off again. Now he has packing material made out of muslin or lint that is shoved up into the wound. Try to get as much as he can over it. Take a stump bandage, put it around the end of the stump, and wrap the stump. This soldier is going to be no good anymore to the Army. He will be sent to a hospital in Harrisburg, Baltimore, Fredericktown, wherever they would be. Now, if he wanted to stay in the service, he could join the Invalid Corps, which would mean he would go to a major hospital, and he might read to some patients that are blinded. He might write letters to patients that maybe have lost a writing arm. He could feed patients, bathe patients in the hospital, and still be in the Army and paid Army pay. If he was sent out of the Army and sent home, pay stops. He's on his own.
All right, you want to give him some air over there and see if we can revive him?
Okay, chloroform and ether settles into the lungs. So he is under heavy sedation. They would slap him, they would fan him. If they could not get him out of it, they would take chloroform and pour it on his privates to making gas for air, which is ice cold like pouring ice water. But you want to expel the gas and everything into the lungs to get him to breathe.
Talk about shrinkage.
That was a way in our medical books that they actually did that, yes. Now, contrary to popular belief, it's not bite the bullet or the strap. Ether was 1842, chloroform was 1847. 80 to 85% of all soldiers during the Civil War were put out with chloroform ether.
How do you invent much pain?
Need pain, son?
Would you like something?
I think he wants.
Can I have some laudanum, please?
All right, son.
They're going to give him some Lodrum, which is a pain medication again.
You're going home, son. Take a sip. Take a sip. You're going home to your mom. There you go. Lay back and relax. No, relax.
Does anybody have any questions? Now, if anybody's interested, if anybody feels bad or anything, needs something taken care of, we take Blue Cross or Gray Shield. And where else can you get free medicine and no copays? If anybody has any, yes.
How long did a procedure like this take?
7 to 10 minutes after a battle. Usually a 7 to 10 minutes is what each surgeon had, because there's thousands of men out there. If, like I said, if he shot himself in camp and there was no battle, we could operate on him for 2 hours without a problem with it. But usually afterwards, there are thousands of soldiers coming in here. And if you notice, I am a gray uniform captured Confederate surgeon. I would be operating under their control, brought over here. Lee left 32 surgeons behind when he left the grounds on the 4th, the night of the 3rd of the 4th, early morning. So we were stayed behind. The Union would have gone out, brought us over here to their side, and I would be operating under their control. After the wounded would be taken out of this field hospital here, maybe sent to Camp Letterman, which was up on 30 North, I would be paroled back to my lines. I was non-combatant. That means I'd have to wait till I get a Union major, I'm a Confederate major, to exchange before I could go back to my unit.